Okay, so we're going to do the 42 muscle balancing testing for Touch of Health level 4. And we're going to do some pre-tests first. So hold here, Lori. Okay, hold. This is for your accurate indicator muscle. And then central, hold like this. There we go. And then zip up, hold again, it. And here, hold. And here again, hold. And then the tailbone, and hold. Okay, and relax. And just tug your hair a little bit. That's for hydration. Hold. Okay. So now we can test you. Okay. And initially, we've done some postural analysis just to see how your posture is, because the 42 muscle balancing will really help you with your postural muscles and maybe make corrections. So now we're going to start with the first one, and this is related to central meridian, and it's a supraspinatus muscle. Hold here, and the direction is relax. Is coming in this way, and then hold here again. Okay, how did that feel? Good. So your response is really good if you can give me feedback in relation to how you feel with your muscles. So come to the side, more of a sturdy table, and then I'm going to pull up like this and hold. Good. And then I'm going to go on the other side, and this is the teres major muscle, and relax. And that's related to the governing meridian. Okay, and then we're going to do the muscles related to the stomach meridian. And so this is the pectoralis major clavicular. Sorry, it's this way here, and hold. Okay, and then hold again. Okay, how did that feel?
Good.
Okay. So now we're doing muscles along the stomach meridian, related to the stomach meridian. So we're doing the levator scapula next. So we're going to do the teapot like this. So bend like this, and then bend your body sideways like that. Hold here. And this one, this is an example, is a teapot, so you can hold from here, but you don't have to do that. And then just turn your head this way like that, other way. So we shorten up the levator scapular muscle. Hold tight like this. I'm going to pull out this way, but I want you to keep it in, okay? So meet my pressure. Good. And then we're going to do the other side. So you're just bending sideways, your body, like this. Okay, hold like this. Come back a little bit more. So we shorten that muscle and meet my pressure and hold. Okay, very nice. And how did that feel?
Good.
Okay. So now we're going to do the neck, anterior neck flexor muscles. Still started as part of the central meridian. Part of the stomach meridian. So I want you to hold up like that, and you have to be gentle with the neck by a supporter underneath, and I put light pressure on the top, going straight down. So I'm going to show the direction. So relax your head. So we're going to push down this way, okay? But not aggressively. So meet my pressure and hold. Push up, like there, and relax it. Then we'll move 10 degrees and lift up, or I'm helping her as well. I'm going to push the same direction, straight down, and meet my pressure, okay, and relax. And then we're going to do 45 degrees, and hold like this, and meet my pressure, and relax. And then we're going to turn the other side, and lift up, and then meet my pressure, okay, and relax. And then turn a little bit more, and hold again, and hold. Good. How did that feel?
Good.
So I want you to slide to the edge of the table. We're going to do the posterior neck flexor muscles. And I'm going to assist her here, and a little bit more. So you're right off the edge. Okay. So this one here, I'm not extending her too far, but I'm having her, I'm supporting her underneath her head with my hand. So I'm going to be pushing in an upward direction like this. So I'll ask her, okay, meet my pressure and hold. So hold backwards there. There we go. Okay, and relax. And then slide down. Always supporting your neck. Okay, lift up a little bit. Okay. So that's the posterior neck muscles. So now we're going to do the brachioradialis. So hold in this position and meet my pressure. Okay, I'm going downwards this way. Okay. And then the same thing on this side. I can go on the other side, but my arms are long enough. Meet my pressure. And I always have two hands on her when I'm testing. So that's the muscles that relate to the stomach meridian. So it looks like so far she's locking on those. So now we're going to go to the spleen meridian. So we're going to do the latissimus dorsi. Keep your arms straight, tight to your side. So I'm going to be pulling in this direction like that. So hold tight here, keep my pressure. Okay, so that unlocks. So the left latissimus dorsi unlocked. So you can put this on the spleen like a minus. Okay, and then on this side here, you can go on the other side, but I find I'm okay in this range. Hold tight like this and meet my pressure. Okay, so that unlocks there. So that's two unlocking muscles of the latissimus dorsi. So you can do bilateral. You can put bilateral, okay, or B. So then we have the middle and lower trapezius muscles are the next muscles. So the middle or lower trapezius is in this angle here. You can have her slide off to the table, but it looks like the angle is not bad. She's lower here. So I'm going to be pulling upwards in this direction. Okay, so meet my pressure. Okay, so that's the lower one, and the middle one is in the middle. Okay, I'm going to be pulling up in this direction like that. So I'll do both on the same side. Meet my pressure. Okay, so that locks. How did that feel for you?
Good.
Okay, so hold like this. I'm going to be pulling up. Meet my pressure. Okay, so this unlocks on this side. That's the right lower trapezius muscle. And then on this side here, hold. Okay, how did that feel? Okay, so the right lower trapezius muscle that's related to the spleen meridian is unlocking. And then we're going to do the opponens longus muscle here. So hold tight like this. I use my pinkies, okay, and hold. Okay, that locks. And then hold here, and I'm going to pull apart. Okay, that locks. Okay, so then we'll do the triceps muscles. The triceps are right behind here. So bend a little bit at about 45-degree angle. I'll go on the other side and show you. And so I'm going to be pushing in this direction. So meet my pressure. Okay, how did that feel? And then this one here. So again, the direction is let go. Is this direction here. So hold here. Meet my pressure. Okay. Okay. So that locks. So we had I think the bilateral on the spleen meridian of the latissimus dorsi muscle. Next we'll test the heart meridian muscle, which is related to the subscapularis. So I'm going to be pulling up in this direction. Meet my pressure. Okay. How did that feel? Okay, and again on this side, hold. Okay, so that's locking. So next we're going to do the small intestine meridian. So the muscles related to that are the quadricep muscles. So I want you to bend like this, lift up a little bit here. Okay, my pressure is here and here. So just let it go. It's in this direction. So hold like this, meet my pressure here and here. Okay, that locks. And again here, and lift up a little bit. And you get them to lift up their legs, because a lot of times we're always lifting them. We're going to get tired, especially if you do a lot of people on the same day. And hold. Okay, hold again. Okay. No, hold again. Sometimes the person on the table can get distracted, so I didn't feel her in here, so I had to just encourage her to be present with me. So that seemed to lock. Now this is the fun one. This is with the abdominal muscles. Everyone has fun with that. So bend your knees. I want you to lift yourself up so you're in the sit-up position by yourself, yeah. Okay, so she's bent like this, her arms are crossed in front, like that, and I'll bring her about 80 degrees back, so she's using her abdominal muscles, okay? Usually they'll shake and then they'll drop. So I have one hand here, and I'm putting pressure as if I'm doing this action. So meet my pressure, okay? She's good there. So now I'm gonna do the obliques and transverse. So I'm going to rotate her like this, and the action is, and just relax, I'm going to rotate her back to the center. So meet my pressure, okay? So she's in this position here, okay? Now turn the other way. So now I'm still doing the rotator, the obliques, and meet my pressure, so go, okay? Now she's in this position here, I'm going to do the transverse ones. So stay here, I'm going to hold her legs. I'm going to be pushing this way, relax, and into an upward position, okay? So meet my pressure, okay, and relax. So a bit on this side, so slightly down. So meet my pressure, okay, and that locks. And now go back down. So I assist her a little bit, so she doesn't pull her back or anything like that. You did really good with your abdominal muscles. Okay, so now we're going to be doing the muscles related to the bladder meridian. So if you can keep having your hands to the side, if you put them on the body, you might strengthen some neurolymphatic points or so. So it's always nice to have that. So the peroneus muscles, they move sideways like this. So I want you to think of your last toe going up towards your ear, okay, on the same side. And my action is, and just let go of it, is down like this. Just bring it down. And then meet to neutral position. And resist here, or meet my pressure. Good. So I'll try this side here too, meet my pressure. Okay, so that's the peroneal muscles. Then we have the anterior tibialis muscles. So that's the front part. And then we have the posterior tibialis muscles. Tibia is this bone here. So that's how they relate muscles to the names. So you're just pulling straight up and here, and I support her underneath her ankle or her heel, and meet my pressure. So the action is, let go, is pushing straight down. Okay? So that locked. And hold here, meet my pressure. And hold again. Yes. Okay. Hold again. No. Okay. So the anterior tibialis muscle on the right side unlocks. And we're having people taking notes here, so we have these, which is great for later, because we're gonna balance her after that. So that's related to the bladder meridian. So bladder is here, and then you're gonna just put a minus there on the right. So right to minus. So then the next one is the tibialis posterior muscle. So she's pointing down, and I'm just gonna bring her back up to neutral. She's pointing down and in, okay? So meet my pressure, okay? So here again, meet my pressure, okay? So that was the tibialis posterior. Now we have the sacrospinalis, which is in the back, but we're gonna do the ones, the back muscles. We're gonna just, when we turn it around, we're gonna do them all at that time. Right now we're gonna move on to the kidney meridian muscles. The psoas muscle is the first one. So I want you to lift up, and I'm assisting her a little bit. Keep your legs straight, your knees straight. Okay, turn it outwards and out a little bit. I'm going to support her on the opposite hip so this doesn't fall over. And I'm going to ask her, and I'm still holding her like a hook a little bit, but I'm not holding her a lot. I'm asking her to hold, and I'm assisting. And so we want to prevent any injuries or anything in this area. So I want you to hold there. I'm going to be pushing down. So let go so I can show the direction. So it's this way down, okay? So down and out. And meet my pressure, hold. Okay? So this unlocks. So then you can go on the opposite side if you like, or I have long arms, so I can do this. Straight, turn it out, okay, and meet my pressure. Okay. So that locks. So the left psoas muscle of the kidney meridian is unlocking. Okay, so you can write that on the kidney meridian right here, and L minus. So then we have the upper trapezius muscle for the kidney meridian. So this is the one that she's going to lift up her shoulder and her ear to her shoulder, and we're going to try to separate. So looking straight, that's good. So looking straight inside like that, and the action is to separate. So hold, okay, very nice. And then try the other side. So ear to shoulder, shoulder up, and meet my pressure and hold. Okay, how did that feel?
Good.
It's locking, okay. Some people need pillows underneath their neck, keeps them straighter, and some people don't, so we have a pillow for you today. So the next one is the iliacus, that's related to the kidney meridian. Iliacus, so let go, is outwards, okay? And the action is, I'm going to be pushing inwards, like this. Care with the knee, not to overexert. So hold like this, meet my pressure, good. So I can do it from this side as well. I don't have to switch side, and then I'm going to be pulling towards me now. Okay, good. So that's related to the kidney meridian, all those muscles. Next, we're going to do the circulation. So meridian, so the gluteus medius muscle, the action is she's out 30 degrees or so, and I'm going to be pushing in. I'm stabilizing with this hand. Some people need to pull in, some people need to push in. That's okay. You know, there's different ways, but I'm okay doing it this way. And hold. This is how I usually do it, and hold again. Okay. So the gluteus medius muscle holds. There's the gluteus maximus muscle, but we're going to do it when she turns on her stomach. And we're going to do the adductors, which are the inside of your thigh muscles. So I'm going to pull away, or I can pull, stabilize one, and do an action like this. And it depends what you're used to or what you can do. So I'm going to be pulling, let go, this direction. Okay? So meet my pressure. Good. And I can be pushing this direction. So hold. Okay? So let go. It's let go all the way. I can be pushing this way. So it depends how you want to use your body. So the piriformis is the next one, related to the circulation meridian. So this is inwards, like this. So I'm going to relax. I'm going to be pulling out that way. Okay? Keeping her hip flexed at this 90 degrees. Resist here, keep my pressure. Okay? And now let's try this side here. If they have knee problems, always be aware of that. So you might want to take care of how you can put pressure on her this direction. And hold again. Okay, very nice. So that locked for you. So now we're going to go into the triple warmer meridian, and the triple warmer. We're going to do the teres minor muscle. So we're going to bring the arm in this direction like that. Okay, so meet my pressure and pull. And so we'll move on this side. I didn't mark it down on this one here, so I forgot. Okay, how's that feel? Okay, so triple warmer, we're going to do the sartorius muscle, which is the action is I'm going to be rotating or pushing down and rotating and straightening out her leg action. So I want you to, there's pressure on her above her ankle and pressure here. So meet my pressure. Okay. And then let's try this side here. So the action is this pressure this way and this pressure this way, and like that, okay? So meet my pressure. Okay. And then the gracilis, there's different ways of doing gracilis, which is kind of is like an adductor muscle or a muscle of the groin area. I tend to do it this way, slight flexion of the knee, just slight, where the foot goes on top of the other foot. People do this in standing. There's another variation where you're on your stomach, and it's in your Touch for Health book. So I'm going to be pushing outwards. So so let go, so I can show, is this direction here. Okay, so meet my pressure. Okay, and let's try this side here. Slight flex there. That's good. And then meet my pressure. I'm stabilizing my body, I'm keeping my back straight, so I don't hurt myself. And meet my pressure. And the action I'm doing is this. Does that seem to lock for you? Then the triple warmer also has a soleus and gastroc, lower calf. We're going to do it on her stomach. So the gallbladder meridian is the next one. And we're going to do the anterior deltoid muscle related to the gallbladder meridian. Meet my pressure. So the action is relax, is straight down. And then let's do this side and hold. Okay. Popliteus is another one for gallbladder, but we're going to do that on her stomach as well. Variations of that muscle as well. Now we're going to do the liver meridian muscle, the pectoralis major sternalis. The action is 45 degrees out and out, up. Meet my pressure. Okay. And hold here. You can switch sides, but I'll be okay this way. Okay. So that unlocks. So the right liver, or for the liver meridian, the right pectoralis major sternalis is unlocking. So the rhomboids are another group in the liver meridian. So squeeze together, okay? Just relax this arm here. just like that. So the action is, while she squeezes together on both sides, is to pull, and I go, is to pull out this way. So I stabilize here a little bit, and then hold tight together. Now this one I'll have to go on this side, and meet my pressure. Okay. So that tends to lock. How did that feel? Good. Now we're going to do the muscles that are related to the lung meridian. So lung meridian, anterior serratus muscle, reach to the ceiling, and the action is pushing down this way. Okay. So I can do variations if I stay in back here, but I feel comfortable in this way. And meet my pressure. Okay. And then try this one here, and then meet my pressure here. So that seemed to work well. The coracobrachialis is a small muscle, like in this area here. It's attached to the front of the shoulder blade, coracoid process, and to the shoulder, or the arm, which is the brachialis part. Okay, and so I want you to flex, relax all the way, like that. So the action is more 45-degree angle, relax there, like that. So meet my pressure, okay, and then go like this. So you're bringing it out a little bit, and okay. So that seemed to work for you. So the deltoid is the other one. This is more the middle deltoid test. This is related to lung meridian. So meet my pressure, okay, and I'm going meet my pressure again. Okay. So I'm going straight down with this one, and just let go. I'm going this way, okay. So that held. Now the diaphragm muscle. There's different ways of doing this one. The way I've been taught is you get the indicator muscle. Okay, hold. Okay, and then you touch on the diaphragm, either one side, both sides, or in the middle as well, and get them to breathe in. So meet my pressure. As they breathe in, I test. Or at the end of their breath, you can test. There's variation, so that seemed to lock. Now we're going to go to the large intestine meridian. We're going to test the fascia lata. Lift up your leg, some assistance. Keep your knee straight. Okay, turn it inwards. So the action of stabilizing her on this side, the action is, and relax, is towards the opposite foot. So meet my pressure, okay? And then lift up, turn it in, and then I'm going to do the same thing. Hold. Okay. So the right fascia lata of the large intestine meridian is unlocking. So the right is minus, okay? And then we're going to do hamstrings later. So the quadratus lumborum muscle, which attaches to your low back from your ribs to your hips. And we're going to have her in this position. So the action is I'm going to stabilize her here and relax. I'm going to pull her towards me. Okay. So meet my pressure and hold. Okay. And I can do it from this way and push, but I find that's not comfortable enough for me. So I'm underneath here. I stabilize it here. I'm going to say push. I'm going to resist. Meet my pressure. Okay. Okay. Hold. Okay. Hold again. Okay. So I just had to retest her because I felt it wasn't holding, and I gave her a different opportunity, another opportunity to hold. So the left quadratus lumborum, related to the large intestine meridian, is unlocking. Okay, so now we have to test out the other ones that we missed for the other meridians, because we're going to have her go on her stomach, and we're going to just test those out. Okay? So this one is the sacrospinalis muscles. They go all along your spine, and she's in trouble, so we're going to put her under arrest. Okay? So this is a good position for her to start. And the action is that she's going to go look over her right shoulder in this position, all the way towards that wall, if we can get her to do that. So turn around like that, okay? So that action. So my action is pushing here and stabilizing her on her hip and hold, okay? So just let go when I tell you to. Okay, let go. This is the position, okay? So now switch to the other side. Okay, and lift, look up, look like that. Look back to me, towards me. Left, that's it, and hold. Okay, and relax. Now you get to go home. And you can relax your head there. So that was the sacrospinalis muscle. But other one that we miss. So now I'm going from the top of her body down. So the gluteus maximus muscle we missed, that was for the circulation meridian. So there's two ways of doing this that I've seen in different testing books as well. So here, I get her to lift up her leg, so you can relax your head. Okay, and you're going to hold it there. I'm going to stabilize her on her hip on the opposite side. I'm going to push down on her heel. Hold. Okay. That's one way. The other way is lift up. I'm going to push down on her hamstring, on her thigh. Hold. Okay. So she locks on both. Just sometimes they talk about if you touch the actual muscle, you can inhibit it and stuff, but that test is interchangeable. Lift up here, and then hold again. Okay, and relax. So next one, we're going down. So it's a certain order, I guess, because we start from the top, we're going down, is the hamstrings that we missed. Okay, that's related to large intestine. So the action is to pull down this way. Okay. So I stabilize her on the top here and meet my pressure. Some people cramp up like this. So you have to put your hand there when they cramp in, and then you can use some of the techniques by shaking and stuff, and it'll go away and hold. Okay. So that's the hamstring. And so now we're going to go on to popliteus, which is related to gallbladder meridian. I'm going to have her turn inwards like this with her foot, and I'm going to do a rotation on her foot like this. Okay. So hold like this and meet my pressure. Try the other one. And if they have ankle sprains and stuff, this might be a hard test. You have to always, when you do your testing at the beginning, when you're asking questions, you have to ask if they have injuries and whatnot, and then you'll be aware of this. Okay, hold like this. That's good. So now we're going to do what's further down, the gastrocnemius muscle. So in this position, relax. Okay. So she's going to hold in this position, and I'm going to push up. Okay. Now actually, relax. You're going to hold in this position, and I'm going to push down. I have her shorten her muscle here. Okay, so she's contracted. Now from that position, I'm going to push downwards. Okay, so relax. I'm going to push downwards like this and up at the same time, and hold. So that's the gastrocnemius muscle, like this, and hold. Okay. So from this position, just bring her down a little bit. We're going to test the soleus muscle. There's different ways of doing this, but I've seen this one before. You're just pushing down like this. Okay. You're going a little lower so you don't get the hamstrings, and then meet my pressure. Okay. So it looks like this. Hold. Resist. And then do the other side and hold like this. And that's good. So now we've tested all the 42 muscles, that postural muscles, that in the Touch for Health level 4 that are required, or their requirements. And that's it there for this, and you did a good job. Wow.